Public health experts sound the alarm about a recent jump in HIV cases.
Liz Bonus tells us why it may be another tragic outcome linked to the addiction crisis.
Quite a show of support here from all over our community here at the Northern Kentucky Health Department, where they made this announcement today. Providers here and across the state and at St. Elizabeth Healthcare all coming together to make sure we share an important message of prevention, treatment, and testing.
We are here today because monitoring has revealed a shift in risk factors.
At this news conference today, Dr. Lynn Sadler and other public health experts said the jump in HIV cases is likely linked to those who use needles to inject drugs, so needle exchange programs getting support.
Experts estimate that for every $1 invested, communities can save $3 to $7 on HIV treatment later.
Testing and treatment for both addiction and HIV also the focus.
Individuals who are living with HIV infection are being linked to services early and often as much as we are able.
As these graphs show, in Hamilton County, HIV cases have jumped more than 30% in the last year, mainly in young people ages 15 to 24. In Northern Kentucky, nearly 50%. Most of those cases in Campbell and Kenton Counties.
HIV, as you may be aware, is a sexually transmitted disease as well as a blood-borne pathogen.
The team here said injected drug use has not been identified as a big risk factor until now.
This represents a 3- to 4-fold increase over what we typically see.
We do have local research being conducted for treatment in our area. Dr. Carl Fichtenbaum at the University of Cincinnati told me that here in this lab, his team is doing an HIV prevention study. They're testing a new medication in those at risk, but injection drug users are excluded in this trial. One of the main reasons here, the team says.
This situation is concerning.
Now, we do have information online for all of what you heard here today. If you're interested in needle exchange programs, interested in further testing, or interested in future research, we have that for you at local12.com. In Edgewood, Liz Bonus, Local 12 News.
And the public health team says it is now conducting what's known as a cluster HIV investigation just to see if any of the new cases